Good morning, Mr. John. My name is Shamelia Howard, and I'm a student nurse. And today we're going to be doing oral hygiene. Okay?
So that is already raised to a height.
First, can I please check your wristband just to verify your name? Perfect, Mr. John. Okay? And I'll be checking the suction just to make sure that it is working, should in case we'll need it today.
I'm just going to don your legs with a blanket. I'm going to fold it in a diamond shape.
I'm now going to place the waterproof pad on the bed. And I'm going to turn you in a Sims position, which is on your side.
Diamond shape. Alright, and I'm just going to wrap this one around your leg. And then the other one around your other leg.
I'm also going to be placing the kidney basin right under your mouth, so that if you have any spills or any water in your mouth, it will drain right in the kidney basin. I'm now going to be pouring the mouthwash into the cup and also some water into the cup so that I could rinse your mouth.
I'm going to
I'll be using the first two sets to clean the cheeks of your mouth. I'm going to be squeezing off some of the excess mouthwash off of the toothset, and I'm going to prepare it to clean your mouth. I'll first put on my gloves,
rinse it out a little.
because once you're dealing with body
wrap this around my hand, like so, to perform the cleaning of the perineal area. So for the perineal area, we start with the labia majora with one finger. So on one side, I use one finger and I clean this way. Then the other side of the labia majora on this side, and then the inner, so the labia minora on the inner side. And then I'm going to take another towel here.
So I'm first going to inspect your mouth, Mr. John, just to see if there's any redness or any swelling in the mouth area. Okay, it's fine. And then I'm going to use the first two sets. Dip it in the mouthwash, then squeeze off any excess of mouthwash off of the toothset, and I'll be cleaning the cheek of your mouth.
Okay, so now I'm going to remove this blanket, making sure that her gown is lower.
Once I've cleaned the side of your mouth, Mr. John, I'm going to dispose of this first toothset. Then I'm going to be using the second toothset.
Okay. So I will put this in a garbage.
I'll also dip the toothset into the mouthwash and squeeze off any excess mouthwash off of the toothset. I'll be doing the roof of your mouth.
In a comfortable position. And perform hand hygiene before I leave.
And then the third toothset will be for the other side. So now I'll be using this toothset for the top teeth.
Yeah, I forgot to put just a second or something.
And I'll be using the last toothset for the bottom of your mouth. The bottom teeth.
1 minute left.
Okay?
1 minute left.
Perfect, Mr. John. Okay, Mr. John. So now I'll be removing all the equipment from your bed, and I'll be positioning you back on your back, and I'll lower your bed to maintain comfort for you. Okay, Mr. John? Perfect. I'll be removing the gloves, repositioning the bed. And now I'll be performing hand hygiene and ensuring Mr. John's comfort. Okay, Mr. John, so now I'll be coming back later on today just to see if everything is working.